Welcome back to Did You Know, a podcast by Partner Veterinary. In this series, we explore all things veterinary medicine and all things partner. In each episode, we answer some of the most common questions that we are asked, from HR to emergencies and everything in between. If it happens at Partner, we'll cover it. Picture this. You're out for a morning hike with your dog, or your cat is exploring the backyard. Suddenly, your pet yelps, jumps back, and you notice something is wrong. Could it be a snake bite? And if it is, do you know what to do? All snake bites are medical emergencies. Whether venomous or not, every second counts. And the actions that you take in those first few minutes can make all the difference. In this episode, we're joined by Dr. Leah Simons, an emergency veterinarian in our Richmond location. Dr. Simons has treated numerous snakebite victims and tells us everything we need to know, from recognizing the signs of a venomous snakebite to what we should never do, and why getting to an emergency vet like Partner is your pet's best chance at survival.
My name is Dr. Leah Simons. I graduated from Cornell University in 2014 with my degree in veterinary medicine, and then did a small animal rotating internship at Red Bank Veterinary Hospital in New Jersey, and then moved to Richmond and started working as an emergency vet in Richmond and kind of bounced around to some different general practices and ERs, and eventually ended up at Partner.
Thank you so much for joining us today, Dr. Simons.
Thank you for having me.
What brought you to Partner?
So I was a relief veterinarian for several years before I ended up at Partner. And that means that I was kind of bouncing around to different clinics and doing freelance work. So filling in where people had the need for emergency doctors because of, they had their doctors out for illness or maternity leave or were short-staffed for whatever reason. So I started working at the Partner location when they opened their Richmond ER hospital. I think my first shift was like their second day ever when they opened. And slowly over time was just picking up more and more shifts there and really enjoying it and liking the staff and the environment and how much we do for the pets and the pet parents and, the good quality medicine. So that's what kind of kept me around and made me sign a contract there.
Wonderful. Well, we are so grateful to have you on the team.
Yeah.
So today we are talking about snake bites. And I know recently there seems to have been a lot of pets that have come in with snake bites, which prompted this discussion. Can you tell me before we begin, is this normal for this many snake bites, or how many snake bites does Richmond typically see in a year or a summer or a season that is typically snake season?
Yeah, so snake bite season.
Yeah.
We see, I don't know an exact number. I know I did run the number of how many doses of antivenom we've given monthly, and we've given about 20 doses a month. So those are, how we treat our more severe snake bites. So we probably see a whole lot more than that. Not all of them need antivenom. But this is definitely the time of year that we tend to see snake bites, around the warmer months of the year. And I'd say we're probably just seeing a lot more people that are aware of snake bites, that are seeking veterinary attention, that are more kind of noticing the symptoms with their pets and getting them to a vet immediately rather than just watching their pet at home and waiting. And I think there's a lot more availability of emergency care for snake bites and antivenom and doctors who are, good at treating these. So I think a lot more people are reaching out to us rather than just kind of waiting and watching and seeing what happens at home. Another thing is that because we're seeing more warm weather, so with climate change, we're seeing our snake bite season extending a lot. So we see snake bites earlier and earlier in the year and going on later and later into the year. I think our first snake bite this year was in March, and previously I would not have seen that in the past. Yeah, so we're definitely seeing a longer season for them, and just more people who are bringing them to us for care, which is great.
That is good. And that's essentially what we're going to do today, is talk about the do's and don'ts for when a pet is bitten by a snake, or an owner thinks that their pet has been bitten. So what precautions can people take
Yeah, so snakes generally, the venomous snakes that we see in this area most commonly are going to be copperheads. We do sometimes see water moccasins or rattlesnakes. Those are a lot less common. And most of these snakes are just kind of going about their business and not bothering us. And their bites are really a defense mechanism. So it's usually our pets being curious and kind of, poking their nose where their nose shouldn't be or pawing at something that they shouldn't be pawing at. And a lot of those things happen when we're not supervising our pets. So I would say the vast majority of our bites happen when dogs are outside off leash unsupervised, when we have outdoor cats that are outside doing whatever they do outside.
Sure.
Or, occasionally we do see snake bites when owners are taking their pets on walks and they're letting them kind of root around in the bushes. So avoidance is really the best thing that we can do to avoid snake bites. Snakes are something that we have to live with. They're part of our ecosystem. They have a really important job in our ecosystem, and they're not trying to hurt us. They're just trying to live their life. So the more we can avoid them, the better. If you are worried that you have, venomous snakes on your property, there are some businesses that do safe relocation of snakes. And importantly, just walking in really well-lit areas, using flashlights, wearing boots when you're on walk so that you don't get bit, and then just discouraging your pets from kind of putting their nose and their feet where they shouldn't, I think is the best thing that we could do.
Yeah, that's a really good point. I hike a lot with my dogs, and sometimes they're on leash, sometimes they're off leash in areas where I can do that. But this is making me rethink that, especially during these warmer months, as I've done a little bit of research and before we had this call looking into it, I'm like, I might need to keep them, a little closer to me.
Yeah. And there is avoidance training. There are some people who do good avoidance training classes where they teach animals to be able to detect snakes and to avoid snakes, and do kind of positive reinforcement with avoiding snakes. So if you're somebody who tends to hike a lot or be out, in the wilderness with your pets and you're worried about that, then there are resources that you can look into in advance, since, if your pet gets bit, you're kind of out of luck if you're out in the wild.
That's really good to know, that there's something like that we can be proactive and look into. How do people know if their pet was bitten by a venomous snake? What is the best way for them to know that?
So the answer is you don't. So a lot of pet parents don't know what to look for. And there's a lot of things that can look like snake bites. And we've been fooled. I've definitely been fooled before and done, a workup to try to figure out, is this a snake bite or is it not? The things that can look like snake bites are going to be other animal bites and stings. So if a pet gets stung by a bee or some other kind of venomous or, poisonous insect or animal, or things like abscesses. So we very often see cats that come in that have an abscess on their paw that's swollen and painful, and people don't know if it's a snake bite or not. And there's different ways that we can evaluate that area and try to tell you if it is or isn't. Kind of the hallmarks of a snake bite are going to be an acute area that's painful, swollen, bruised, and usually your pet will tell you that something has happened. So dogs are pretty notorious for, they go outside unsupervised, they come inside, half of their face is swollen, they're painful, they're acting weird, they don't want to eat, they don't want you to touch them, they're really telling you that something is wrong. And usually you'll notice that the swelling will progress really rapidly. Most commonly in dogs, they're going to get bit either on their muzzle or on their front paws. Again, the defensive mechanisms of the snake, it's usually your pet going after them. So the muzzle is kind of the most common place that we see snake bites, but the front paws are as well, or a back paw if your pet steps on a snake by accident. And then with cats, usually it's the front paws because it's cats smacking the snake.
Right.
You can imagine how that happens.
Yeah.
So if you see any area that is acutely swollen, painful, bruised, sometimes you'll see the little, the spots where the fangs went in. Sometimes you don't. So don't, depend on that to know if it's a snake bite or not. But the best thing to do is have us see them, because we see them all the time. So we know what snake bites look like and we know how to identify them. And there are as well some blood work markers that can help us to identify if a pet's been envenomated or not.
Okay. Yeah, that was going to be my next question. So yeah, you can do blood work that can help tell if it's a snake bite.
Yeah. So not necessarily, there's not like a test for venom. There's, a lot of people ask, is there a test that you can do that will tell me how much venom my pet got or how bad it is or what type of snake it was or something like that. And there aren't really any tests for that. But there are some characteristic changes to the red blood cell morphology that we can see when we do a blood smear that can make us more inclined to think that it's a snake bite versus not. And then if it's something like an abscess, those pets come in with a fever. We can aspirate the area and find purulent discharge. There's other, health changes that we can find that tell us, hey, maybe this isn't a snake bite, maybe it's something else.
What does venom do to our pets?
It does a lot of things. So the biggest issue is the local effects from the venom. So it causes local destruction of cells. It causes a lot of inflammation, edema, vasculitis, sometimes necrosis. And then that venom circulates throughout the body, and that can cause widespread effects throughout the body. So in our pets that have other underlying issues, I always warn people, if your pet gets bit and they're pregnant, they're nursing, they have underlying kidney disease, they have an immunodeficiency disorder, they're dealing with a cancerous disease, the venom can surely set off any of those other problems and can be very unpredictable. Things like infection at the bite site is something that can be seen very rarely. It's only about 1% of cases that ever experience an infection at the bite site. So that's not something we initially worry about, but because of all of the tissue destruction, that can be a delayed side effect. And then the biggest thing, which is the reason why most people need to come and see us, is to do blood work to test for bleeding disorders. So the way that the snake kills their prey is by immobilizing them, and that's done in a few different ways with the enzymes in the venom. And one of the major ways is causing bleeding in that animal. So the venom itself can cause a venom-induced consumptive coagulopathy, which is a big fancy term that essentially means that it can cause bleeding disorders. So it can cause destruction of platelets and the factors that help us with our clotting. And those are tests that we can test for to tell you if your pet is experiencing those really harmful effects, and then give them antivenom to counteract those effects if we need to.
What should people do if they think that their pet has been bitten by a venomous snake? What are the steps that they need to take?
Yeah, so anytime you have concern that your pet's bit, even if you're not sure if they were bit or not, or if you don't see any swelling, but let's say you just saw a snake launch itself at your pet, bring them in to see us, because the most important thing for us to do is to provide them pain management, keep them hydrated, monitor the bite site for any changes, and do those blood work tests that I mentioned to check for those clotting abnormalities. And venom can be kind of a dynamic thing as it's circulating throughout the body. Some animals come in and they have very minor signs. They're not super painful. They're not super swollen. And then maybe 3-4 hours later, things look very different. So it's really important that we see these guys when it happens, as soon as it happens, if possible, and then also monitor them, even for a dry bite where they've got no venom, there's no swelling, there's no, health changes that we can see. Those pets should still be monitored for a period of time to see if anything changes with them.
And I know we had also talked about if they have any collars on or anything like that, those should come off right away. Is that correct?
Yeah, so because dogs usually get bit on their face, we do want you to take off any collars or restrictive clothing to allow that swelling the place to go. We don't want to impinge their ability to breathe, and we don't want to, make them more uncomfortable and more compromised.
The internet is full of information, some good, some not so good, misinformation. Are there at-home remedies like icing snake bite, tourniquets, suction, giving medicines like an antihistamine? Are these things that are good advice, or do these fall into the what not to do list?
Please don't do any of that.
I had a feeling that was going to be your answer.
The internet's full of a lot of things. Unfortunately, a lot of misinformation about snake bites. I don't really know why. My suspicion is just that snake bites tend to happen very commonly in areas that are more isolated, maybe where people don't have access to medicine. And I think people are, reasonably trying to do something at home to give them some peace of mind and, do something for their pets and feel like they're doing something to help their pets when maybe they can't seek veterinary attention or medical attention for themselves. I don't know what the reasons are, but all that to say, none of that stuff is safe or recommended. Some of those things can be very harmful. So I think kind of the old school way of treating snake bites was to keep the bite below the heart, try to block off the blood supply, don't let the venom circulate throughout the body. And that's not recommended anymore. So the worst thing that you can do for these bites is to cut off the blood supply, and, not let that area, swell and, move where it needs to go. So, things like icing and tourniquets and cutting and suctioning are not actually helpful for getting any of that venom out. I think I read a study where they tested the suction devices and it got less than 2% of the venom out of a bite site. So that's not really helpful. And all you're doing is cutting off the blood supply to that area and risking necrosis of that area. Other things that people commonly do is give medications at home, again, with good intention. And I don't blame anybody for doing this, but some of those things are not helpful. And a lot of those things are are harmful. So the things that fall into the category of not helpful are things like antihistamines, steroids, antibiotics. Those are not recommended for snake bites. They don't necessarily do any harm, but they're just not helpful. And, I hate the idea of somebody wasting time trying to give oral medications to a painful animal rather than getting them where they need to go for medical treatment. Snake bites are not histamine responses, so antihistamines do nothing for these bites. Under the category of harmful things would be things like non-steroidal anti-inflammatories. So a lot of pet parents will be familiar with medications like carprofen and meloxicam and Onsior. Those are all potentially harmful to these pets because they can interfere with clotting, and we're already worried about clotting in these pets. So those are things that you just don't want to do. So the best thing to do is just get them somewhere for medical care. Unfortunately, there is no at-home treatment other than taking off their collars, taking off restrictive clothing, keeping them calm, and just getting them somewhere for treatment.
And time is of the essence. The
Yeah.
quicker you can get to a vet, your primary vet or an emergency vet, the better.
Yeah, I would say trying to get to an emergency vet. So I think, kind of talking about ways that we could be more proactive with snake bites, taking some time and looking up where's my closest ER and do they carry anti-venom? I think that's very helpful for people to know. There's not, even though your closest vet might be your primary care vet, they might not be equipped to handle snake bites. They might give the wrong medication, or not refer you to the right hospital or not know what to do. And then you're wasting time. So it might be beneficial if partner's your closest hospital and maybe they're another 30 minutes from where your primary care vet is, take that extra 30 minutes and go to an emergency hospital.
Okay. And partner does carry anti-venom at all times?
So we have anti-venom, and anti-venom is the real hero in all of this. I think, in vet med, there's not a lot of things that we actually have true antidotes for. And this is one of those cases where we do. So it's a really powerful medication that we can give. Anti-venom is a medication that's made by exposing horses to small amounts of snake venom and then collecting their blood and taking out the antibodies and then essentially infusing your pet with antibodies. So it's kind of like giving your pet the ability to make an immediate immune response to the venom and giving them something that neutralizes that venom. So we always carry it. It is not the cheapest medication, so it's always important to think about pet insurance, think about saving up some money if your pet is maybe more of a high-risk patient or goes out unsupervised or goes hiking or anything like that. But it is the best treatment that we have for these guys for serious envenomations. The anti-venom treats the pain, it treats the swelling, and it treats any of the blood work abnormalities, and it can be used at any point after an envenomation. If we're seeing ongoing complications, it's most useful within the first 6 hours of a bite.
So when a person brings their pet in, what can they expect from start to finish and then aftercare?
Yeah, so when a pet first comes in with a suspected snake bite, they're usually kind of triaged as a more critical patient, and we bring them back. And almost all of these pets, we're going to ask an owner for permission to give them an injection for pain and to pull some blood work. So all of these pets get pain managed, and if we can, depending on how handleable the pet is and depending on where their bite is, usually we'll mark where the bite is and where the swelling is so that we can keep track of that. And sometimes shave the area just so we can keep an eye on what that bite looks like and how bad the bruising is. Typically, once we have a conversation with these owners, we're recommending some baseline blood work. So that includes a CBC, which looks at red blood cells and white blood cells and platelets, as well as checking clotting factors to check for that venom-induced coagulopathy that we discussed. While these pets are in our care, we usually recommend keeping them for hospitalization. So with any bite, and every doctor is a little bit different, but I always recommend hospitalizing these pets because of that dynamic nature of the venom as it circulates throughout their body and because we can see delayed consequences from the venom. So hospitalization allows us to get them on IV fluids, keep them on pain meds, and do serial monitoring of what their bite site looks like, how are they feeling, and then also look at that blood work every 4 to 6 hours to look for changes. While they're in our care, there's a few different indications for when we would use anti-venom. Sometimes I'll use it just to treat the local tissue effects, so just the swelling and the pain. If I have a pet that's super painful or their bite site is swelling progressively or a bite in a really nasty area, we'll sometimes see bites like to the eye or the tongue, or an animal that's a brachycephalic, so like one of our Frenchies or our English bulldogs who gets bit on the face and they, already can't breathe on a good day and then they have this huge swollen face. Those are all going to to be really good reasons to give antivenom. And then our pets who have blood work abnormalities are also going to be good candidates for antivenom. So it's, in my mind, it's always better to give it than to withhold it. And that's an infusion that we can easily give. It does go over about an hour, and it is an IV infusion, so they do have to be hospitalized for it. But then afterwards, most of these pets who get antivenom feel pretty great. A lot of them don't even need pain meds afterwards. A lot of them can go home the next day or within about 12 hours after that infusion. And then they just go home with some, as needed pain medication, and they don't necessarily need any follow-up. For our pets who don't get antivenom or don't get hospitalized for whatever reason, we do recommend that we follow up on them either with us or with your primary care vet to keep an eye on those clotting factors. And we do recommend that they be rechecked in about 12 and 24 hours after the bite to check those values.
And is there any long-term effects from snake bites that people need to be aware of for their pets?
Not necessarily. So I think if you read anecdotal reports in human medicine, that there's a lot of people that complain about long-term nerve pain and muscle pain and swelling and, other disabilities from snake bites that were not treated, where they didn't seek medical attention or didn't get antivenom when they really needed it, or whatever the situation might be. I imagine our pets also have the same issue, and they just don't have a way to tell us. So that's why I'm more inclined to give antivenom than to withhold it, because I'm sure there's a lot of issues that our pets deal with that they don't have a way to communicate to us. As far as any documented long-term effects from the envenomation, no, we don't really see that in our pets. Some delayed consequences that we can see is infection or necrosis at the bite site. So days to weeks later, if that bite site is looking kind of black or smelly or unhealthy, there are some rare cases where we can need to do surgery at a bite site if it really lost enough blood supply that we need to remove some tissue there. And then with pets that receive antivenom, we can see a delayed hypersensitivity reaction called serum sickness, which can happen about 2 weeks later after they've received antivenom. In people, they get like a rash and a fever, and our pets usually they come in with like some joint pain and fever, and we just treat them with anti-inflammatories.
What would you say are the main takeaways when it comes to keeping your pets safe from snakes?
Yeah, so I think the big thing is that we need to learn how to cohabitate with these animals. I think people being aware of the risks and what to look for and how to keep their pets away from snakes is really the best thing we can do. I also think that snake bites are not cheap problems to treat. I think the more people can be aware of the cost of these things and prepared with an emergency fund or pet insurance, you'll, be more inclined to be able to provide the treatment for your pet that they need should this happen. And that goes for any emergency situation, but especially in our area where we see snakes all the time. But the real big thing is that there's no safe at-home treatment for snake bites. The best thing you can do is get them to an emergency hospital. We are well equipped to handle these cases and to treat these guys. We see them all day, every day. We can do it. We can help you. So just come to us if you need us.
Thank you so much for taking the time to chat with us today about this.
Thank you.
Thank you for listening to Did You Know? Is there something about Partner that you want to know? Email us at letstalk@partnervesc.com. Who knows, we might turn your question into an entire episode. You can now find us wherever you listen to all of your other favorite podcasts. Subscribe now.